More than 4 million registered nurses work in the United States. A large share come from South Asia, India, Pakistan, Bangladesh, Sri Lanka, and Nepal. India is actually the single largest source country for foreign-trained nurses in the United States. These nurses staff emergency rooms, they staff nursing homes, long-term care facilities, and community clinics, often in medically underserved areas. As ICE agents across the United States continue to crack down on immigrant communities, well, the documented and undocumented people that are being served, many of these medical workers are worried. So here's some background for you. In 2025, U.S. Immigration and Customs Enforcement, also known as ICE, rescinded much of its guidance on sensitive locations. That guidance had discouraged enforcement at places like hospitals, clinics, and general health facilities. With those protections weakened, ICE is no longer formally restricted from entering healthcare settings where these medical personnel work. For South Asian nurses, many of whom care for immigrant patients or have mixed status families themselves, this obviously creates immediate uncertainty. This isn't just an immigration issue, it's a healthcare issue, and it's hitting nurses on the front lines. So here's why it matters. South Asian nurses disproportionately work in settings where immigrant patients are seeking care, including emergency departments, community clinics, and long-term care facilities. Recently, these healthcare workers are reporting new challenges, including the following: keeping patients' care during possible enforcement actions, also safeguarding patient records and immigration-sensitive information, and of course, managing legal and ethical responsibilities under extreme stress. Many describe a dual burden, caring for patients while also protecting them from ICE presence. But there's another consequence, which is that the fear of ICE is driving patients away from the care that they need. To immigrant communities, this is essentially devastating. Healthcare workers report patients skipping emergency visits, skipping their routine checkups, prenatal care, and childhood immunizations. For nurses, this challenges everything. Patients arrive later, conditions are more severe, and care becomes more unpredictable and obviously more emotionally taxing. South Asian nurses in particular face a specific tension. Culturally, family and community responsibility are central. Professionally, nurses are bound to care for all patients, and legally, they must navigate ICE presence, detentions, and unclear institutional rules. So this is not theoretical. It's happening in real hospitals right now. So how are medical facilities responding? Hospitals and clinics are adapting in real time, training staff on how to respond if ICE appears, clarifying what information can be shared and what can't, educating patients about their rights, and trying to create internal, safe pathways. But nurses say the fear remains, especially with the immigrant relatives and with patients they know personally. And then there are potential long-term effects. When immigrant families avoid care, entire communities feel it. Children miss checkups, elderly patients delay treatment, and chronic illnesses go unmanaged. Advocates are urging clear protection for hospitals as sensitive location, more legal support for frontline healthcare workers, greater public awareness of patient rights, and so much more. South Asian nurses represent a critical backbone of the U.S. healthcare system. They fill staffing gaps, serve vulnerable communities, and keep hospitals functioning. As ICE enforcement escalates, the situation may only get worse. And for immigrant communities, it means every hospital visit from now on carries an underlying fear, making the promise of care far more complicated than it should be.